Okay, is that too loud? Perfect, okay. Good, we're going to talk about heavy metals tonight. And if you came to hear these guys, I think this heavy metal band is down the street somewhere. So just in case you're in the wrong place. So I used to be a wild stallion. So heavy metals, how many people brought their heavy metal reports, hair analysis, blood test? Anybody? No? Okay. So we're going to be talking a lot about comparisons and how to deal with detoxing and how to test. And so some things may correlate really well with your particular pattern, but we're all a little bit different. Heavy metals are something that can be quite devastating to our health, and we're going to go through some of the things that it can cause. Some of the things that have been known to be caused by all these different heavy metals are cognitive decline, lower IQ in children with lead, learning difficulties, mood problems, high blood pressure, infertility, chronic fatigue, osteoporosis, kidney damage, even cancer, diabetes, hormone disruption, immune disruption, and blood abnormalities. So quite a number of things. And when you look at this list, you think, well, wow, that's all over the body, right? What do all these things have in common? And the problem comes down to metals. These toxic metals start replacing the normal minerals that our bodies need for normal biological function. So your body is ending up using lead or mercury or cadmium instead of calcium, magnesium, iron. So we'll talk more about why certain parts of the body are affected, but that's basically what happens. So wherever your weakness is, that's where it's going to show up. It may show up in your liver or your red blood cells or your brain. But part of the picture is just the mineral itself, and we can detect some patterns with a lot of these. Should we be worried? Now, back in 1999, that was, 14 years ago, the CDC tested urine and blood samples in 3,800 people. I think this is one of the biggest studies. And they found that 10% of children and women of childbearing age had enough mercury to cause health damage, which is pretty dramatic. I mean, it's probably much, much more than that, but for the CDC to come out and say 10%, that's pretty dramatic. And it didn't make much press, obviously, because they really don't have much to say other than this, Mercury was also regularly introduced into children through vaccinations by the use of thimerosal, and up to 2004. And you want to ask if any of you are getting flu vaccines, you want to make sure that they do not contain any more thimerosal. So you want to make sure and ask about that. Thimerosal is a preservative that contains mercury. So what happens when you inject mercury into your bloodstream? It immediately goes into your immune system and starts challenging it. So that's where a lot of autoimmune problems come into, get their start, and that's incredibly toxic. Yes? Yes. Right, contact lens solutions would also have heavy metals. Yeah, mercury. We're going to talk more about mercury in a minute here. Should you be checked? Yeah, I think everyone should be checked. Especially if you have a lot of chronic health problems that aren't quite explainable, and you have to end up taking a lot of medication to, help your liver or your kidney or your nervous system, or you've got Alzheimer's, or, there's just so many things that heavy metals, I'm always thinking of heavy metals when I'm talking to patients, because that could be the underlying problem, and I like to find out where people grew up and what industries were in their area, where they grew up, what they were exposed to. Nowadays, everyone travels so much, and we eat food that's grown, miles and miles away, so we're exposed to all kinds of different things equally. But in the Northwest, we especially have high levels of aluminum and arsenic in our water supply. So, many metals increase the risk of cancer. Health problems that don't respond to typical therapies, even something as simple as low thyroid, could be due to heavy metals. If your body is making reverse T3 to compensate for the high metals, then you're going to end up with low thyroid symptoms. Okay. So multiple unrelated health issues may be due to a toxic metal overload. Now, when I question patients, I always say, well, do you think you might have been exposed to heavy metals? And the answer is always, well, no. I eat really cleanly, I exercise, I do the right thing, I get lots of sleep, I grew up on a farm, I should be safe. Well, not necessarily. A lot of people are exposed just from the foods that they're eating from a distant place. They're being exposed to all kinds of chemicals in the water, even just showering. You're absorbing a lot of the metals and the chemicals that are in the water, unless you have a shower filter. Some people still drink tap water. Amazing. Could have quite a few heavy metals in there. Living on the earth is a potential exposure. And, we've been preceded by 100 years of industrial waste and industrial carelessness that have dumped these metals into our environment. And it's showing up in the fish and the insects and the foods and the soil. So I just want to make people aware of all these things. A lot of people say, well, I played with mercury on the floor as a kid and kind of, it was fun to play with. And I don't worry too much about that. It likely wasn't a big exposure, although mercury is very volatile. So when you have mercury fillings in your mouth and you're chewing something acidic, like tomato sauce or spaghetti, it releases a lot of fumes, and you breathe those in and it goes right in. So, yeah. Should you have all your amalgams removed before the challenge? Not necessarily. You could just see what your toxic levels are. And then you can decide, okay, I've got quite a bit of mercury there. Maybe I should really, have all those removed. It depends on what shows up. But yeah, you wouldn't, with one chelation and one test, you wouldn't necessarily have a problem. We'll talk about that. Yeah, we'll talk about that. So most contact with heavy metals is through daily living, breathing, washing, eating. So a lot of us aren't even aware of what we're exposed to. A lot of people will come in with symptoms like fatigue, malaise, anxiety, depression, allergies, even candida infections. I almost always find some kind of heavy metal component when people have fungus or candida in their colon, because the candida are specifically drawn to cleaning up that heavy metal. So they actually absorb that. emotional distress, mood disorders, of course, chronic fatigue, fibromyalgia. Notice these are all things that really affect the person long-term, chronically, almost every cell in the body, and that's why we think of heavy metals. Irritable bowel, ADHD, severe allergies, both allergies and severe allergy. Family history of cancer. And notice there's a lot of disorders that are corresponding to autoimmune problems. So ALS, learning disorders, I won't go through the whole list, colitis, even diabetes. They found arsenic can tie up the insulin receptor sites, causing diabetes. Infertility can be a problem, birth defects, hypothyroidism we talked about. List goes on and on. So even for a lot of cardiac arrhythmias, I will have people test themselves to see if the heavy metals are disrupting their normal nerve input to the heart. And sometimes a person will respond to high-dose magnesium to kind of chelate the metals out of the heart tissue. The heart uses a lot of magnesium for that, for that particular, for the rhythm issue. So Parkinson's, lupus, schizophrenia, these can all be related to heavy metals. Well, a while back I stopped trying to guess what metal might cause what condition, but because everyone's a little bit different. It's if they're lacking one thing, the heavy metal will go in and replace it, and their body will recycle it and treat it just like another essential mineral. No, the heavy metals don't necessarily stay there, because you're eating good food, you're eating organically, you're getting good minerals in there, and that will help replace those eventually. But it's kind of like, working upstream. If you've got, say, colitis or bowel problems, and you're trying to get good bacteria in there, it would take quite a while to replace it over time. It might be better to, kill off the abnormal bugs and then put the good bugs in there. Okay. Oh, here was the study that, it was a JAMA study in 2008, and they found an increased level of arsenic exposure in type 2 diabetics. Now remember, when you see conventional studies like that, this is basically a blood test. So they're not even measuring the tissue levels that are in the deeper parts of your body. They're just looking at the serum levels, and that represents just recent exposure. Okay. Now, even though we call them heavy metals, not all metals are heavy. For example, aluminum is incredibly light. Heavy metals and toxic metals are defined as having no biological benefit. Okay, no biological benefit. In fact, they often do harm in very serious ways. Many toxic metals take the place of essential elements or interfere with normal physiological function, causing illness. So it's not as if your body can recognize these things and sort of attack it and get rid of it. Because it's used to dealing with minerals, so it will accept these things, and even small amounts, your body will take it on and just work with it. So that's why we end up, getting more and more. In a few minutes, we'll talk about why certain metals go to certain depths in the body. We'll come to that in a second. Thorium is something that can imitate calcium and make bones weaker. So, the best thing would be to make sure your calcium balance is there, prevent osteoporosis, osteopenia, and that would kind of block that thorium from, getting in those particular layers. Toxic metals accumulate in the tissues in our food supply. So in the oceans, some fish will eat smaller fish, and then that fish gets eaten by a bigger fish, and it keeps concentrating the heavy metals over and over again. And just like we're eating fish, smaller fish than us, we collect and deal with those heavy metals too. So I don't want to get too technical here, but I want to explain a couple of principles that I found that seems to correspond to a lot of the research. All these minerals will have a valence it's called, and it's basically a charge, so like oxygen is -2, calcium is +2, hydrogen is +1, it's basically the electron charge. And when the metals go into your bloodstream, it affects how the electricity happens in your bloodstream. So it kind of the things like lead or aluminum or cadmium can bind to other elements just based on that charge or that valence, okay? So I don't want to get too chemical here, but aluminum has a +3 valence, which is, one of the highest. And that's why it's so damaging. We think of lead and mercury as being a big problem, but aluminum is really, really bad, and it's so prevalent. And where does it go? Right into the nervous system. So, and it's one of the hardest things to deal with because it is so prevalent. So when you look at the metals that occur on the periodic chart, is everyone familiar with a periodic chart? Yeah, okay. Probably didn't come to see this tonight, but I wanted to give you a couple of things that I've learned. I worked with a chemist for a while, and he discovered that different layers on the periodic chart, these are all minerals, okay? Essential minerals and toxic minerals. So he discovered that, this particular row, starting with sodium over here, all these minerals tend to have an affinity for the serum in the body, okay? And then as you go down each row, it goes to the next compartment, okay? So after the serum, then there's the cellular matrix, okay, inside the cell. Stop me if I'm too technical here. And then you go into the nucleus of the cell, and the nucleolus, it's called. So it keeps going further and further. This might give you a little bit of a better picture here, but here's, let's pretend this is one of your red blood cells, okay? Or not a red blood cell, but just a regular muscle cell or nerve cell, let's say. So outside the cell is your serum. That's the liquid part of your blood. And that's where aluminum shows up. And that has the +3 valence, remember, okay? So that's why aluminum can be so devastating. It can cause high blood pressure. It can attach to all kinds of other minerals. But the good news is it comes out of your body quickly because of where it's located, where its affinity is, okay? Yeah. Nickel, the nickel that, yeah. Well, like stainless steel cookware. Yeah, that's a good point. Nickel is found in stainless steel. And yeah. Yeah, and we think stainless steel, that's pretty safe, right? We use that in Pyrex basically. But yeah, some nickel can get into your food that way. So then, this is what's called the cytoplasm or the matrix inside the cell, and that's where the arsenic and the nickel show up. I'll get your question in just a second. And then in the middle of the cell, there's what's called the nucleus, which contains the DNA, and that's kind of the brain of the cell. So it's telling everything else what to do. And that's where the cadmium and tin and other elements show up. But here's the bad news. You go to the deepest part of the cell, and that's where the lead and the mercury are. And what's the hardest to get out when you do IV chelation or do any kind of heavy metal detox? What's the hardest to get out? Lead and mercury. Yeah. And they're usually the last to show up. I'll test people and see how they're doing, and yeah, the lead and the mercury are still there. It's really hard. Was there any questions about it? I know that's a little chemical there, but. Is there any cookware that's safe to use? Does anybody else have anything to say about that? I use Pyrex, and I use some ceramic, but they might have lead in it, On top of the stove, yeah. Well, most people use stainless steel. Of course, everyone's removed their aluminum cookware. That'll go right into your food. The cast iron can be a problem, especially with tomato sauces and acidic foods. That'll get in, and if your iron is too high, which is common, that will get into your system. Yes. Yeah, now I can't go backwards, Ken. Some elements are radioactive, but those occur way down here. Yeah, way down on the periodic chart. Okay. And remember, radioactive elements, what do they do? I mean, you may be exposed at a certain point to radioactivity, and it doesn't show up for 30 years because what it's done is just slightly altered some of the DNA in the nucleus, in the nucleolus. Okay. So that's how you kind of look at the periodic chart is, and also when you're looking at the columns on the chart, they tend to be antagonistic if you go one column to the next. Like if you've got too much copper, you can use zinc to pull out the copper. And on the periodic chart, the zinc and the copper are right next to each other. Okay, so you can use the minerals, and you can treat yourself. I mean, if you've already done a hair analysis or some other test, you can kind of see, okay, I've got a really high cadmium. How am I going to get rid of it? You can use essential minerals that fall in that same category. Make sense? They're balancing themselves out valence-wise. Exactly right. Yeah. And they'll have different valences in the same row, but they will have an affinity for that area. So we're going to talk a little bit about the nasty 5. These are the ones I don't like to see on the tests when I check people. because these are the most, have the most impact on a person's health. So I'm going to show pictures of the elements and what they look like in the raw form or in the ore. So aluminum, interestingly, it's the most abundant metal, and it makes up 8% of the Earth's crust. So why is it so toxic? It's very light, has low density. It has increased deposition in patients with poor kidney function. So the question becomes, what came first? Did it actually aggravate the kidney, or are the kidneys just gradually getting worse from the aluminum? Aluminum exposure is mainly from cookware, antiperspirants, antacids, and also baking powder. So when you're purchasing baking powder, make sure it's aluminum free. Even antacids, I think, are marked now if you need that. Yeah. Like aluminum monohydrate, or yeah, aluminum is used in a lot of makeup and lotions and creams. They don't have to really report what's in there, and there can be heavy metals in there, definitely. hmm Oh, so it's tricky, yeah. It is tricky, and no one knows all those answers. I mean, some of these products can be very toxic, even though it has very innocuous elements to it. So it can be damaging without a lot of research behind it. So I'm not sure how to answer that question. Yeah, sure. Okay. Aluminum can increase the estrogen-related gene expression in breast cancer. There's pretty good research showing that. It's also, of course, linked to Alzheimer's. Brain plaques have been found to have increased levels of aluminum. So I'm always amazed when research comes out saying, oh, there's no correlation between aluminum and dementia or Alzheimer's. There really is. Yeah. I don't know if there's just one cause. I think that's part of the problem with the research is we can't just blame one toxic metal. It could be a lot of, or it could be a combination of things. Now they found through doctors' data that hair aluminum is elevated and zinc is low in ADD and ADHD and also in autism. And that's something to look at in children. There's also an association with aluminum in fibromyalgia. And interesting, one study showed that malic acid found in apples, along with magnesium, is effective in lowering aluminum levels. Okay. The magnesium, yeah. Oh, and the malic acid. Oh, that's right. Okay. Yeah. How many apples do you need? I think you can buy malic acid tablets too, in beer making or wine making. I I would suspect either one. Yeah, either one should be helpful. Yeah. Oh, good. Okay. So we sell that in combination. That's great. Another interesting study, you've heard of BioSil and silica. A lot of people take it to help build their hair and nails, but they found that that is very effective in helping to remove aluminum. It increases kidney excretion and prevents absorption through the gut lining. So you could even use horsetail tea to help with that. And let's go on to cadmium. Now, when I think of cadmium, or when I see it on a test in a patient, I almost guarantee that either they smoked in the past or their parents smoked. Secondhand smoke is a big source of cadmium. So, and remember, as a child, your body is developing around these exposures, whether it's a heavy metal or a chemical. It sort of is part of your development, and your body adjusts to that. So it affects your health for the rest of your life. Cadmium came into use after World War I as a fertilizer. 86% of industrial use is in batteries and electronics. It's also found in fossil fuels, oysters, anchovies. Smokers have 4 to 5 times the blood levels and 2 to 3 times the kidney levels than non-smokers. Yes?
Does that mean we should stay away from anchovies?
If you're an anchovy addict, I would say you might get your cadmium checked. Yeah, yeah, that would be good. Good point. Yeah, I see welders come in and they said, oh, they always say, I feel fine. I've been welding all my life. And they've got really all these issues come up on their bloodstream, and we check their heavy metals, and it's just off the chart. And years ago, not that long ago, they wouldn't use any protection. They would just do it in the open air. So, and I still get Boeing people, coming in, and they're exposed to a lot of fumes and heavy metals, and they're not well. Let's see. Is cadmium volatile? Well, it must be. Uh-huh. Oh, it must be, yeah. Well, if it's released in cigarette smoke, it must be volatile. So to some degree. Let's see. It blocks calcium in at least in animal neurons. So it could be a problem with any kind of neurologic issue, whether it's a neuropathy or ALS or Alzheimer's. It's been linked to lung and prostate cancer. And of course, any kind of toxic metal can, what does your body do with that? It tries to sequester it and perhaps, store it into a form like a atherosclerotic plaque. So it could fall into capillaries and cause blockages. And that's what builds up blood pressure, because the heart has to pump harder. If you ever see on a blood test your serum alkaline phosphatase is elevated, it could be cadmium. Welders, again, construction workers exposed to cement dust. Here's interesting, people who use refrigerator drawers as a grill. For some reason that has more cadmium in it, so be careful of that. And we're going to talk about when to chelate, when not to, but because of the kidney's affinity for the cadmium, you want to make sure the kidneys are operating well. You don't necessarily want to load the kidney with a whole bunch of cadmium when it's already damaged. That's when people, really suffer from even one IV chelation can really aggravate their symptoms. Here is lead. It just looks heavy, doesn't it? More than half of all lead processing is in the manufacturing of automobiles. Of course, lead-based gasoline is still a persistent source of lead. It keeps getting recycled throughout the environment. Other sources, pottery, paints, solder, even newsprint will have some lead. And also remember, whatever you put on your skin, whether it's a lotion or a cream, you just count on that getting absorbed. It's probably between 20 to 40% absorption, but you're getting quite a bit of whatever you're feeling there. The skin is incredibly absorptive. I've had gun enthusiasts, they're shooting at a gun range and they inhale the smoke, and sure enough, there's a lot of lead in their tissues. Now lead, remember, lead can go very deep within the body, and that's why it has more neurotoxic effects. It can interfere with hemoglobin synthesis, so it can make you anemic. And when people really feel that tiredness and fatigue, a lot of times it's due to the lead buildup. From doctors' data, again, they found that hair lead over 1 part per million correlates to hyperactivity in children, and over 3 parts per million cause learning disabilities. And here's some things that help to remove lead: vitamin C, calcium, magnesium, zinc. High protein diet will cause slow but gradual elimination from the tissues. So again, if you're getting the good elements in there, it's going to eventually take over and replace the toxic metals, because your body does want to remove it. It's not as efficient at utilizing those toxic metals compared to the essential minerals. High dose vitamin C, you mean like an IV vitamin C or regular powder? I think it does help. It's hard to get really high dose vitamin C. Most people can only handle 5 to 6 grams maybe before you start getting loose stools. But yeah, even that level can help. Yeah, vitamin C is one of the best antioxidants. And mercury, most of us know a lot about mercury, but it's incredibly toxic. Now, just to clear up a couple of things about mercury, there's dental mercury, and then there's also mercury found in fish. So what's the difference? What are you seeing on your hair analysis? The difference really is that there's something called inorganic and organic mercury. The inorganic is also called ethyl mercury, and the ethyl mercury is much more toxic. Much more toxic. And it's found in dental amalgams. So that's another reason to never put any mercury fillings in your mouth. The good news is it doesn't accumulate as efficiently as the methyl mercury or the organic mercury. So what they found is, depending on your exposure with fish and dental fillings, it's about a 15 to 1 ratio. So your body will accumulate more of the organic form than the inorganic. So that's good news. I mean, we have control over how much fish we eat or how much mercury is in the fish. But a lot of us have already been exposed to the amalgams, so it's going to be harder to get that out. And also the vaccines have the ethyl inorganic mercury too, so much more toxic on that level. And where does all the mercury come from? Where do fish get all the mercury? You know, what's really happening is these coal-burning plants spew the fumes out into the air, and it just gets carried over to the water, to the oceans. And everything settles in, and the oceans absorb a lot of the toxins that we give off, and it goes right in there and settles into the water, and the fish just consume it. And that's another reason why you should probably avoid shellfish, because the shellfish are the bottom fish, you know, and the metals go right down to the bottom, and that's where it collects, and that's where they live. So oysters, shellfish, lobsters, those have more toxic metals. I don't think you may find labels on there. I know like Grecian formula used to have lead in them. But some dyes will use toxic metals to. Well, I don't know what the laws are around that, if they have to say all that. But I know a lot of topical creams and lotions and products don't have everything. They just say proprietary combination, or, you know, who knows what's in there. The Grecian, I think they took the lead out. You know, it got such a bad reputation that sales went down. Yeah. You know, that's a good question. I'm not sure how much mercury might be in sea salt. There are other minerals in there besides sodium chloride, so there could be a little bit. Uh-huh. Well, yeah. I mean, sodium is essential. Um, but to answer your question, okay, how do we chelate out heavy metals utilizing just the valence? I'm not sure there is an answer to that. But if, you know, for something like aluminum, it may attach to a chloride and something else, an oxygen, or, you know, or a +1 valence, you know, in combination, and that will become soluble and come right out of your system. Well, they tend to collect in various organs, you know, like cadmium will show up in the kidney quite a bit. Mercury, I think, tends to correlate more in the colon. You know, it'll deposit there more readily. So it depends on how your body's getting rid of it. Okay. Yeah. Yes. So an Epsom salt bath, you're actually pulling liquid, you know, out of your feet. Your feet get all prunish and everything. So it's actually pulling some minerals out, you know, good and bad. Yeah, I often recommend Epsom salt baths. Not necessarily as a major detox, but you absorb some of the magnesium in it. It'll help to if you're especially low, then you'll absorb quite a bit. So. For a foot bath? Uh, yeah. Well, you could do a 1 to 3 cups of Epsom salts in a full bath. Yeah, in a full bath. Yeah. Now, when you're exposed to mercury and you've got low selenium, it can exacerbate some of the adverse reactions. So, and you might notice selenium coming up a lot with heavy metals. It seems to be something that's protective. So think about taking selenium, especially if you've been exposed or if you're chelating out. They found higher rates of autism near coal-burning plants. Interesting. Mercury overload is associated with excessive candida overgrowth in the GI tract. So because a lot of the mercury stays in the gut, it actually feeds the yeast and the candida. Each 1 part per million of hair mercury is associated with a 9% increase in heart attack risk. And then there's arsenic. Tends to be high in the water in the Northwest. I'm not sure why. Occurs in insecticides, well water, shellfish. It can accumulate in the thyroid gland, also in the hair, skin, bone, GI tract. And also, if you have really big half moons on your nails, that could be a sign of too much arsenic. Everyone know what I mean by that? Yeah. Acute exposure is very toxic. It can cause fatigue, weakness, loose stools. It affects the nervous system, the ability to make red blood cells. And that's the arsenic competing with iron to make your red blood cells. And selenium is a major antagonist to arsenic. Okay, I wanted to bring up this study just to help you think about ways to detox heavy metals. It's incredibly simple, but I've used these quite a bit in ways just to help detox a certain heavy metal. So this was a study done in India, and they found, of course, in India they use a lot of homeopathic medicine. So there's a remedy called arsenicum, which is just homeopathic arsenic. And they did a long-term study. They began with a 3-month study to see how people improved with their blood tests and their symptoms. This particular research showed some amazing pictures of the feet and the skin of these volunteers and how it had improved just by taking the homeopathic arsenic. So it actually encourages your body to pull it out and chelate it out. I mean, it's so simple, but so effective. The good news is there's remedies for just about all these things. Because in the old days, when the homeopaths were coming up with these remedies, they would use these metals and things that would have an incredibly dramatic effect on the body, because it would affect your emotions and all these different organ systems. So it gave a really unique picture. So when they gave the homeopathic arsenic, it would relieve those symptoms. Okay, we all know about homeopathy and how that works. No. Well, I'll tell you a little story. I had a patient who she came in to see me, and she had lost all her hair. She was 28 years old, and when she was 7, she got chicken pox. Okay, And she lost most of her hair at that point. It got really thin. At age 9, she got a really high fever and she got measles and she lost all her hair. So between age 9 and age 28, she was bald and had to wear a wig. So obviously, there was a lot of emotion around that. And so what I did was I gave her homeopathic chickenpox and homeopathic measles. It's too simple, right? And immediately, she started getting tingling in her scalp, and, I had her do clay packs and massage her scalp, and it all grew back. Incredible. Oh, she would come in and we'd just weep, it was like amazing. But that's the power of those remedies. It's just incredible at changing it's almost like an acupuncture treatment in a few pellets. It changes the energy in the body. So. No. She was enough, yeah. Oh. Yeah, there's a lot of different causes, of course, but she was kind of unique. It was very easy to figure out what was going on there, but yeah. Oh, I made a remedy out of chickenpox virus, and gave that back to her in increasing potencies. So it went deeper and deeper, yeah. Well, it started out with a 12 and a 30, and yeah. So that's why I love my work so much. Okay, so here we're going to talk about how do we figure out what metals we have? What's the best way? Is a simple hair analysis enough? Should we check it in the urine? Do we do a blood test? How accurate is that? Or there's a new test called a metal allergy test. So we can measure antibodies to lead or mercury or cadmium. How effective is that? And there's also reverse T3 that I like to use, and we'll talk about that. So we're going to go through just the advantages and disadvantages quickly. Now the hair, of course, is easy to collect as long as you have some. And a lot of the metals will show excellent correlation to tissue levels, but a lot of them don't. Because when you think about it, the hair follicle is supplied by the blood, and if the metal isn't in the bloodstream, it's not going to show up in the hair follicle. So if your body has sequestered some of these, like lead and mercury, it tends to not show up here. Some people will use, or some practitioners use pubic hair because it's much more long-term. I think it grows at about the seven times as slow as scalp hair. And also you have to worry about hair being contaminated. A lot of people use all kinds of different things on their hair, or just walking outside in the smog. You can be exposed to different metals. So pubic hair may be an alternative. But again, it's hard to estimate how accurate that is compared to tissue levels. Hair only grows a half an inch per month. So, when you're taking a sample, you usually take the inch or 2 inches closest to the scalp, which would represent the last few months. Okay. Hair only measures mercury from fish or methylmercury, so it's not going to show your amalgams. So a lot of people look at that and say, oh, yeah, I got to get those amalgams out, but we don't know how much is in there. Not accurate for lifelong exposure and subject to external contamination, especially aluminum, nickel, silver, and tin. Those things are fairly volatile. So what about blood serum? a lot of conventional docs will just do a blood test. You know, they'll say, you've been exposed to lead, let's check you, and sure enough, there's nothing there. And remember, even with the hair analysis, what they're doing is showing averages. Okay, so you're compared to the population, and it could be thousands of people or hundreds of thousands of people, but you're still just comparing yourself to other people. Versus, okay, what's your ideal? I mean, you may be more sensitive to mercury than the next person. You may have more health effects from the mercury, even though it's a much lesser amount. That's a good point. What is normal? What is baseline? I mean, normal would be none. Yeah. But that's the state of our testing with that. And again, blood serum will show organic mercury levels, not the inorganic. It reveals only recent exposures, not accurate for deeper tissue levels. Okay, and then we go to urine testing. And this is very easy, even for kids. You can do it before and after an IV challenge. Okay, we'll talk about that in a minute. And there, I've found that a lot of practitioners use very different methods. You know, some people use DMSA, or they'll use a product like HM Chelate, or they'll consistently use just one product and then do a measurement and compare that to everybody else in their practice. And I guess you could do it that way, but the IV challenge is probably the gold standard for all of us. There's been the most research and the most standardization. You can go to acam.org and find a practitioner who will do this. It's it's very standardized, and we all do it pretty much the same, so we can compare the results. Well, that shows both. That shows both. And it's hard to divide up. You know, it's not really divided, so yeah. And the disadvantage is you're dependent on the kidneys. Okay, so when you do these tests, you'll see that they also measure the creatinine level to see how well your kidneys are filtering. Because if your kidneys aren't doing too well, you may have less show up. So they kind of standardize it even more based on your kidney function. And there's something called retention toxicity. So your blood levels may be high. You know, you may be chelating some of these out, or you may have shown up for a chelation, and because your kidneys aren't working too well, you reabsorb a lot of the metals again. You know, so that's why I don't like to see people, they do an IV and they feel worse from it. You know, that means that they've been aggravated from it. It's not good. Something is blocking that. So everyone has a copy of this, but I'll just mention here that really the gold standard is doing a 6-hour urine collection before you get your IV. You know, and then you do the IV and collect the 6-hour urine after that to see what comes out. And do you see the advantage of that? Because you can see more recent exposure on that first one before the IV. Because if all your numbers are really normal and they're all to the left side, you do the IV chelation and then all this stuff pours out. That means that it's in the deeper tissues. Okay. Makes sense. So most of us will do just the IV and the 6-hour collection and see what comes out. But, you know, it's nice to compare to see what you're dealing with more recently, say with fish intake. You know, how much of that is being consumed. The other thing is you can correlate what your treatment might be. So let's say you do a, whoops, I got to go back. All right. So looking at your chart, where are we here? Thank you. Okay, so looking at that chart, when you do the pre-IV urine analysis, okay, then you do the IV and you do the 6-hour follow-up, let's say the mercury is about the same, or the lead's about the same. You know, that's a good sign. That means you don't have a lot of deeper lead in your tissues, okay? There might be one or two things that show up as being significant, but that's a good sign. If, on the other hand, you're showing greater than 5 times, let's say mercury or lead is 5 times the level it was in the pre-IV collection, then you would be a candidate to have the IVs, IV treatments. Because it's high enough in the deeper tissues, that's about the only way to get it out. Okay. And in the middle, you know, let's say the post-IV collection shows between 3 and 5 times what the first urine collection was, then you probably get away with some kind of oral chelation. You know, you can do at your own leisure. So that would be something like DMSA or you know, Ultra Clear Renew or some other product that will gradually pull that out. We'll go over some of those things. Does that make sense? Okay. And then I just discovered a new lab, and they're combining all these things. So they're looking at your lead and blood and urine, and actually giving you feedback as to, okay, this person needs liver help before they do any detox, or they need kidney support first, or, you know, take them off fish, or, so it's a little more exact when you can see all these different tissues. The problem is it gets pretty expensive. You know, you can imagine all the testing that has to be done. Well, you know, I'm not sure the exact price. If you want to look up the lab, it's Quicksilver Analytics, and I would just call them and see what they offer. Yeah, Quicksilver Analytics. Yeah, I do not. No, you don't do computer. Yeah. So this would also tell you, you know, let's say you have high hair and high blood levels, and the kidney levels don't really match what you're seeing in the blood or the hair. That would say, okay, we really need to work on your kidneys, rebuild that, and then you could do some more chelation. But until then, I would wait until your kidneys are working better. Same with liver function. Any kind of detox when the liver is stressed is going to create more problems. You know, whatever you're detoxing, whether it's chemicals, heavy metals, yeah. Quicksilver Analytics, yeah. And there's a laboratory called Neuroscience Laboratory, and they're doing antibody testing, which is interesting concept. So what we're assuming there is that, it's kind of like anything else. If you're producing antibodies to something toxic, then your body is reacting and your immune system is reacting, and it's inflammatory, it's a big deal, versus something that's just kind of going through you and not a big problem. And according to their brochure, they found that 75% of people that were positive for reactivity had more than one metal antibody, which I thought was interesting. So in other words, this blue section is just the 25% that only had one antibody to one metal. But most or the majority of the people had two reactions, two metal antibodies. Okay, and some people had 3, 4, 5, or greater than 5. So. And I thought this was interesting too, because they found what antibodies corresponded to the most number of symptoms. And what shows up as number one? Aluminum. There's also some other bad ones there, but so in other words, the people who were showing antibodies, over 25% had symptoms. So significant. Titanium, yeah. True. Titanium relates to all kinds of things, topical. And I think a lot of you are aware of Dr. Lamson's research here at the clinic. He found a correlation between reverse T3 and heavy metals. And he found that when you're checking a thyroid panel, of course, your T4 is going to branch off into free T3 and reverse T3. So some people make very little free T3, but they're making all this reverse T3. And he kept thinking, why is this happening? And then he went backwards, and he found the people that had high reverse T3 that had done heavy metal testing were all high. It was pretty interesting. And to this day, I still find this correlation. It's if I find a high reverse T3 over, say, 21, then I will check for heavy metal toxicity, or at least, consider that as a problem. And you also see the reverse T3 come down as the metals get removed, and the thyroid works better. I don't know if he's ever published. Yeah. No, reverse T3 is not normally done for most, well, if you go to an endocrinologist, they're just going to do TSH and at the most T4 maybe. They're not going to check your antibodies unless it's, way out of whack and nothing gets controlled. They hardly ever check reverse T3. Usually. Well, in Washington State, you can order your own tests. You can go anywhere but pay for it. Well, come to the Tuesday talks. Oh, it was quite a while ago. I think it was in the 90s at some point, yeah. Well, you're right. Normally, we don't encourage people to do IV chelation until they have the source of the problem removed, because otherwise, you're just getting more and more. In fact, the the danger could be you could lose a filling. It could dislodge your filling. So I guess that's no danger, but yeah, you'd be okay with that. But yeah, it's not like you're starting over. You may have removed some of the mercury out of your tissues, but yeah, I mean, you're going to get re-exposed every time you chew. So. Okay, so we're talking about treatment. Any other questions about testing or yeah? Really? Meridian Valley Lab does it. Not affiliated, but oh yeah. I'm surprised LabCorp doesn't do that. I think PPL does it, but yeah. Well, she was saying that LabCorp no longer does reverse T3, probably because no one asked for it. Most doctors don't ask for it. Okay, so you've got your test done. You've got high something. What are you going to do about it? Okay, at a minimum, you can do the homeopathic, right? You can do the homeopathic, and gradually over time, it's going to tell your body signals to pull that out of your tissues. Very, very simple and cheap. If it's, of course, really, really high levels, you want to consider doing the IV treatments because it could make a huge impact in how you feel and also prevent all those problems we went over in the beginning, including heart disease and Alzheimer's and atherosclerosis and ALS and on and on. So it is very possible to get this out in an efficient and easy way. The moderately aggressive treatment would be using something like DMSA, which is an oral chelation, but it's very convenient. You can do that at home. And it's based on your weight. And just like the IVs, we only recommend doing it every so often. Like I usually don't go beyond once every 2 weeks. It's just too hard on the body. Because if you're doing it every week, the IVs pull out the good minerals as well as the bad. And you want to give your body time to, eat organic food and get the minerals back and replace the essential trace elements. Yes, the DMSA will also pull out essential minerals, so you want to replace those. I want to mention here I've had some amazing results with modified citrus pectin. I think I've told some of you about it, but if you did nothing but that and the homeopathic, you're going to benefit. It's been shown, and I'll show you one case I had that was pretty phenomenal. And I also like sauna therapy. Infrared saunas work very well. And I wouldn't bother so much with the steam sauna, just do the infrared. Okay. The infrared heats up the core circulation inside the tissues, inside the organs, and then your body is more able to pull that out. Okay. Yeah, most gyms, most fitness centers don't have infrared. In fact, they keep it so hot, you can only go in there for a couple of minutes. You'll sweat a little bit, but not enough to really make an impact on the metals. So, yeah. Well, that's a good question. We're going to talk about that in a second, but the modified citrus pectin seems to have both soluble and insoluble fiber to actually, enter the bloodstream and help to bind the metals there. So it's also in the gut and in the liver, but also in the bloodstream. So, yeah, the whole pectin fiber probably wouldn't do the same. It might do a little bit, because as our livers are ejecting the metals, then it'll clomb onto it and wash it out. Yeah. There's one I really like. Unfortunately, it's the most expensive, but it's Pectisol, made by Econugenics. And yeah, I really like that. Yes. Yeah, pretty much everything I say is available next door. Is the DMSA as effective as the suppository? Probably. I haven't used the suppository much. There is a rectal suppository you can use to pull heavy metals. I haven't really looked at the data. I probably should have for this talk, but I didn't get there. So when you're thinking of detox, whether it's heavy metals or chemicals or anything, you want to prioritize things. So you first are going to mobilize the toxins. Okay, so that's your chelators, that's your DMSA, that's your any kind of product that's going to go deeper into the tissues to grab onto those. Okay. That's your sweeper. But then you want something that's going to bind that up. You don't want it to get reabsorbed because it's easy to loosen things up into your bloodstream. But you want your liver and kidneys to pull it out of your system and get it out. So you want something to mop it up. Okay? And you want to make sure the drain is open. So a lot harder to get out because you can easily remove copper, with chronic zinc use. Everybody hear me okay? So does that make sense? You want to sweep first and then mop it up and then have it drain efficiently. Oh, zinc will pull copper out. And that's why you'll find a lot of supplements with zinc have just a tiny bit of copper, like a 15-to-1 ratio. Because you need a little bit of copper. I find most people have too much, but you want to be careful of losing too much copper. So your rate of your ability to detox depends on a lot of these factors. So the health of your kidney, your liver, your gut, but also more deeply in the cell, you need glutathione, you need enzyme systems in the cell membranes, okay, because you want to get those metals out through the membrane. You need good liver function, intestinal transport, kidney function. So if you've got something like leaky gut, a lot of inflammation in the gut, maybe abnormal bacteria, that, that might stop you to a point and say, well, let's take care of that first, and then your body's ability to detox would be more efficient. So remember, the liver is going to be dumping all this into your colon for elimination. We used to have Dr. Crinion's clinic up in Bellevue, and he did nothing but this type of detox. So, and he always had people do the sauna and colonic irrigations right afterwards, after their IV. Okay, so that would just kind of wash everything out. So. This is probably too much to look at, but there's various phases that the glutathione detox pathway goes through. And the main thing is ending up in the liver and the small intestine. Okay. So how do we upregulate these glutathione pathways? One way is taking IV glutathione. You can come here and get IV pushes. There's a new supplement. It's rather expensive, but it's called N-acetylglutathione. And it has a liposomal delivery to cross the cell membrane. So that's the theory behind that. It can actually go into the cell and grab the heavy metals. N-acetylcysteine is something that can transform easily into glutathione. So some people use that as a way to promote that pathway. Whey protein, of course, has a lot of amino acids, including glutathione. Green tea extract seems to support that. I'm a big fan of lipoic acid also. It's an amazing liver support, especially if the liver is the limiting part of the detox pathway. And we can also do lipoic acid IVs here too, so sometimes we'll do that. Our lipoic is definitely the best form to use. Yeah, it's the most biologically active, the most effective. Yeah. I think they reduce, yes, they reduce the sulfur. Yeah. I think there's some other ingredient there, but I forget what that is. Other things would be vitamin C, oxidative therapies, of course, exercise, ozone. Astaxanthin is a super antioxidant. Chlorella is also a good binder. So that would be in the mopping category. Okay. And one of the problems you want to watch for with chlorella, though, is because it's grown on a lake. Let's say it's grown on Klamath Lake in Oregon or Crater Lake or something. Because of its strong binding ability, it may already have heavy metals from the atmosphere attached. So, we just don't know how much is already in there. So checking your tolerance for chelation, you want to make sure your liver, kidney, check your digestive function. You want to make sure you're dealing with a leaky gut, and also just your general antioxidant status. So typically I'll use antioxidants and build a person up to help compensate. So this gives a little more information about IV therapy versus the DMSA. So the DMSA, you're basically using about 30 milligrams per kilogram per day. So everyone has a little bit different dosage. And I'll divide that into 3 doses for 3 days. And one of the keys is you don't want to do less than 3 days. because it's kind of like priming the pump to get things moving, and then if you stop too soon, your body can't deal with it and it reabsorbs it. Okay. So you want to keep that going for a little while. And then you take a break for 11 days because you don't want to do it constantly. You want to give your body a break. Same with the IVs. You want to do an IV and then wait at least 2 weeks. The advantage of the DMSA is that it's very inexpensive, relatively. And it definitely works, although it doesn't cross the blood-brain barrier. So it won't go into the brain to remove the aluminum and any other heavy metals that are in there. So that's the disadvantage of that. So the IV treatments are basically the most aggressive. The DMPS is specifically for mercury detox. So if a person does an IV challenge and there's no mercury in there, we'll mainly just do the calcium EDTA. So you won't have to do both if there's no mercury. But the EDTA is, it's FDA approved for heavy metal detox, especially lead, cadmium, aluminum, even in hemochromatosis or iron buildup. It will pull iron out. And we always recommend a mineral IV. After you've had maybe 3 or 4 chelations, you want to replace that with a trace mineral IV to put the good stuff back. So even if you're eating really well, that many IVs can really, pull a lot of trace minerals out. So, yeah. How many IVs for the chelating effect? I've seen as many as 200. Yeah. Some people will do anywhere from 15 to 30 is common. Well, I usually don't recommend retesting until at least 12 or 15. Yeah, because there's an expense with the test, and you want to give it time. One thing I've learned is these heavy metals come out in waves. So you can get an original test, and then 6 months down the road or 3 months down the road, you may have more showing up because your body is sort of, primed and it's starting to move it. Yeah. Yeah, and what I tell patients too is you can do 1 a month or 1 every 3 months, and you're still going to get benefit. Each individual IV is going to benefit you. You don't necessarily have to do it every 2 weeks. Oh, yeah. Yeah, I mean, it depends on how much damage is already done, but yeah, people feel better, things clear up, yeah. I can't say 100%, but it's definitely significant, yeah. Right. Yeah, now that's a different form of chelation used to help remove atherosclerotic plaquing or improve heart circulation, avoid bypass. Although that's using sodium EDTA, which is a little different. So, yeah. But actually, you will remove some of those heavy metals doing that kind of chelation also. Mm-hmm. Um, Everyone is individual on that regard. I don't know if I could comment, but yeah, it's definitely something you want to be aware of. A lot of people do have adverse reactions from even the testing, so you want to be careful. Yeah, yeah. So it may be too much, yeah. Yeah, I mean, he could use something much milder. He wouldn't necessarily have to do the IVs. And, oh, right, yeah. Yeah, I would say, 95% of the people do okay with it for just that one IV. In fact, I'm curious as to how they do on it as part of their program, but for him, it may be, yeah, we may have to do something else. So, yes.
For someone having safety concerns or IV what kind are they?
Well, there's a lot of clinics that do it. I think our prices are pretty good. We charge about, what, 150. It all depends on what we have to use too. But yeah, it's about 150 each. So, this is a little chart I thought you might find useful. So if you've got something like cadmium, what's the top choice as far as chelating? Or can you get away with a DMSA, let's say? If DMSA shows up as a first choice, as a really efficient way of pulling that out, I would say use it. That would save money. So, in summary, we're looking at, again, ways to grab onto those metals. So that would be the IVs, the DMSA, zeolite, perhaps even the modified citrus pectin a little bit. But the advantage of the modified citrus pectin is it actually binds up also. So the second phase would be the binding effect. I really like this product called HM Chelate because it's a combination of various elements, chlorella, algae, to help hold on to it so it doesn't get reabsorbed. There's Ultra Clear Renew made by Metagenics. That's another good product. Dr. Gary Gordon, does everybody know Gary Gordon? He does a lot he's like the grandfather of chelation. But he's got some products. The Essential Daily Defense actually has EDTA in it. And which is kind of interesting because EDTA typically it can't be taken orally because it doesn't cross the gut barrier. So you think, well, it'll just go right through you, right? But he figured, once those metals are coming out from the liver, grab onto it there, and that will hold on to it and chelate it out. And then the eliminators, are just the basic things to keep everything open, drinking lots of water, sweating, exercise, liver support, the glutathione, the kidney support, gut support is a big deal. You don't want to reabsorb the mercury back into the bloodstream from a leaky gut. That's a problem. Oh, what is leaky gut? So for a lot of people, they have, say, abnormal bacteria in the colon or chronic food allergies, gluten sensitivity, fungal overgrowth, and what it does is wear down the lining of the gut, so you can even get a little bit of bleeding or poor absorption. Well, there's more elaborate testing, but usually you can tell either from a stool test or, typically I try to go to the root cause anyway and figure out, okay, are they not absorbing very well? They're not producing enough pancreatic enzymes, HCl, food allergies, those are all things that can contribute. So, yeah. The zeolite, oh, I think it does. I think you get some of that absorbed. Yeah, that's just me. What product? Uh, if you go to a website, there's Zeo Health, I think. Or what is it? Zeolite Health. It's in your references there. Yeah. Oh, really good question. Do you need to go to a particular kind of dentist to get your amalgams removed? The answer is definitely yes. And if you want to go to our website, I gave a talk on dentistry a few months ago, so you could look at all that, and it'll tell you even what questions to ask the dentist on what they're doing. But yeah, if they try to talk you out of doing it, then just go. Find another dentist. Because what that means is they aren't going to take the precautions that are necessary to keep you from reabsorbing the mercury, okay? So that's really important, yeah. Yeah. Go ahead. Yeah, Mitch Martyr. Great guy, yeah. Mitch Martyr's really excellent too. Yeah, if they advertise biological dentistry, that's usually pretty safe. Not always, but. And then, sorry to keep you so long. Here we have some information about saunas. This is a pretty good study. It was done by Dr. Crinion, who used to be in Bellevue. He was a big sauna expert. And I just wanted to mention the modified citrus pectin research you can find on the Econugenics website. Unfortunately, the abstract didn't have all the data, but you can see the arsenic, even after 6 days, he measured arsenic, lead, and cadmium, and he increased excretion of all these things. Lead went up to, 130%, but lead increased 560% on the 6th day. So it really does work, and of course that always, it depends on how much is in their system to begin with, but these were just, average healthy people with no symptoms, and that's what it pulled out. And I just wanted to show you this patient who was a dentist, and he said, well, I don't have time to do the IVs. I'm just going to do the modified citrus pectin. So really fascinating. His aluminum dropped, 78%. His cadmium dropped over 85%. Lead dropped 30%. Mercury dropped 55%. And this was only 6 months. And that was using that Pectisol. So I use this on almost every patient now. Whether they're doing IVs or DMSA or anything else, I feel like that's one of the best products you could use. Yeah. Can you use that when your liver or cidney is challenged? I would say, yeah. I've used these on a lot of people just as a very slow, mild chelation. Yeah. Yeah. Yeah, you could even use it with the amalgam still in your mouth, and it would keep you a little more current without the physical damage, But yeah, it's like swimming upstream a little bit, or with the stream, perhaps. The modified citrus pectin? Yeah, I think that probably works as well. There's more research on the pectosol, but it's probably cheaper. You're right. It's probably cheaper. So. All right. Have a great summer. Thank you all for coming. And if you have any questions, I'd be glad to stay, and we can go through any other information you need. So go ahead.